Right now, we are seeing some of the highest rates of maternal mortality that we've ever seen, particularly among Black women. We know that the disparities between Black women and non-Hispanic white women are pretty stark. And so we're in a situation where, if we don't start thinking about the root causes of this issue, that we're going to continue to see, Black women dying, these premature, largely preventable deaths.
When we think about that, we hear several different things that are hypothesized for causing this big gap. So let's kind of break them down and why they are or maybe aren't responsible for this gap.
Right. And so I think across the spectrum, in terms of research that we see around health disparities, largely in, I think, public health spaces and also in some of the social science spaces, there is this look at, sort of what are the behaviors that contribute to Black Americans, having higher rates of death, and morbidity in certain areas. And so, for instance, if you look at issues around obesity, and we know there are large numbers of African American women who experience obesity, smoking in terms of heart disease and some of these other issues. But when it comes to maternal health issues, we control for all of those things, physical health, even socioeconomic status. We know that even Black and white women who are equally healthy, on equal footing, even in terms of like education and income level, that Black women are still more likely to die. And so I think as we digest the research around this issue, we have to acknowledge the fact that these other factors, these health risks, quote unquote health risks that we see associated with mortality and morbidity do not help us answer questions, in terms of why Black women are more likely to die in pregnancy